Hello everyone, my name is Nurse Daryl, and today I'm going to create my first ever blog, and I have decided to talk regarding health concerns, any topic regarding our health, because I believe that our health is the most important thing. Without a healthy mind and body, we are not able to maintain a healthy lifestyle. So I'm going to give a small background regarding my work. I'm a registered nurse for almost 6 years, and I have a lot of experiences. First, working as a community health nurse, that's my first job. And second is working in a hospital as a staff nurse. And my third experience would be as a company nurse working in the clinics of companies. So with that experiences, I'm willing to share some information, some experiences that I would like to impart to my viewers, and hopefully they would tune in and subscribe. Please subscribe to my channel. So thank you for this opportunity to share my knowledge, my views regarding our health. So first of all, I would like to talk about medicines. So let's talk about medicines. First in my list are pain relievers. So pain relievers, when we hear about pain relievers, first thing that comes in our mind usually are paracetamol, Ponstan, Mefenamic. These are kind of pain relievers that are available, that can be bought in the pharmacy and without doctor's prescription. So let's talk about paracetamol. So paracetamol is a pain reliever usually given for mild pain. So if you have a mild pain, mild headache, you can take paracetamol. And also paracetamol is called an antipyretic medicine, which is really given for people who have fever. And first of all, if you have let me remind you, first of all, if you have fever, we need to talk first or visit first to our doctor, so we could be managed or we could be diagnosed very well before taking medicines. So the first thing to do when you have symptoms is to visit a doctor. And also the first thing to do when you want to take your medicine is check first if you have allergy, because some people may have sensitivities to medicines like anaphylactic shock, which is a severe kind of allergy that needs to be managed in a hospital emergency room. So those kind of situations are to be given a priority. For example, you had a reaction to medicine, you need to go straight right away to the emergency room. So let's talk about paracetamol. So this is an antipyretic medicine and also a pain reliever for mild pain. So this is the first line medicine for fever and for mild pain. And next on our list is let's talk about mefenamic acid. Mefenamic acid is also a pain reliever that is called non-steroidal anti-inflammatory medicine. This is usually given to people who have a toothache, and for females who have abdominal pain from their menstruation or menstrual cramps. So These are the kinds of medicines that are given to those kind of pain. So first of all, if you are pregnant, please check with your doctor before taking medicine, because these kind of medicines are not to be given to pregnant women, except for paracetamol, which is safe for pregnant women. So mefenamic acid are given to mild and moderate pain, like for example toothache and moderate pain from headache and muscle cramps, muscle headache, muscle pain, muscle strain. So on number 3 on our list is ibuprofen. Ibuprofen is also a pain reliever which is called non-steroidal anti-inflammatory medicine. This is given to people who have mild to moderate pain, like the mefenamic acid, but ibuprofen has a effect or antipyretic medicine. This is also a medicine given to people who have fever, but this is not the first line treatment for fever because it is contraindicated to certain kind of diseases, like for example dengue fever. This is contraindicated to people who have dengue fever, who have high fever from suffering from dengue, because it might cause bleeding, it might contribute to bleeding, and as well as mefenamic acid, it might contribute also to bleeding. And if you have comorbidities, like for example hypertension, liver diseases and kidney diseases, you need to watch out for this kind of medicines, mefenamic and ibuprofen. These medicines are not usually given to those people who have comorbidities, like I have mentioned, like liver diseases, kidney diseases, and hypertension. Next on my list is Celecoxib. Celecoxib is also given to those who have mild to moderate pain, like for example arthritic pain, muscle pain, acute pain from surgeries, anything that is anything that has pain and swelling, because this kind of medicines help relieve the swelling and then the pain as well. So, but of course, as I said, this is not usually given to people who have comorbidities like liver diseases, kidney diseases. If you have those diseases, you might not want to take this kind of medicines, because these kind of medicines are called hepatotoxic, which is toxic to our liver and then kidney. And then the next kind of medicine are called patch medications. This kind of patch medications are administered through our skin, which are like a band-aid. It looks like a band-aid that if you will place it on our skin, the medicine will slowly be absorbed on our skin and slowly be absorbed on our system. So this kind of medicines like Salonpas is not recommended for acute pain, because these kind of medicines are not easily absorbed for immediate effect. So you might need those kind of medicines that are taken orally to get the immediate effect of pain reliever. Okay, so let's go to the next kind of medicine, which is this kind of medicines are being prescribed. So you need to get a prescription from the doctor, like Celecoxib, one of the medicines that should be prescribed by doctors, and Meloxicam. This is called also this is a pain reliever also that are given to those who have arthritic pain. But this kind of medicines like Celecoxib and meloxicam are not made to treat arthritic pain because they only relieve the pain and symptoms, but it's not really the cure for arthritis. So you need to consult first to a doctor before taking this kind of medications. And now we get to the higher kind of pain reliever, which are called opioid, like the let's say, I forgot that kind of medicine which is prescribed to those who are suffering from cancer pain. That's called the opioid, or I forgot the name. So those kind of medicines, let's not go further to that, because those kind of medicines are given via prescription by a doctor. So thank you for listening, and I hope you can subscribe to my channel.